to thank the Society of General Internal Medicine and the Lawrence S. Linn Acceptance Committee for awarding me the Lawrence S. Linn Research Grant. I feel honored to have been chosen for this important opportunity to study and improve the quality of life for people living with HIV. In doing an internet search, I found that Lawrence Linn was a research sociologist at UCLA whose research advanced the care of patients, including men who have sex with men, people living homeless, and people with substance use disorder. Much of his work was published in the 1980s at a time when the lives of many of these patients were cut short by the devastation of HIV. At his death in 1990, Dr. Linn made a generous donation that allowed for a hospice for patients living with AIDS, which offered a compassionate and thoughtful way to improve the quality of life for people who were dying before their time. There have since been remarkable advances in antiretroviral treatment of HIV, and now hospice is thankfully an option of last resort. Yet there remain large disparities in HIV treatment outcomes for people living with HIV and opioid use disorder. These disparities may be most stark for people who attend harm reduction agencies. Harm reduction agencies are places that offer services, education, and supplies for people who use drugs. Many people who attend harm reduction agencies are either not engaged or inconsistently engaged in HIV treatment, not engaged in treatment for opioid use disorder, and actively using drugs, all of which are important determinants for poor HIV treatment outcomes. In traditional clinical settings, buprenorphine treatment for opioid use disorder improves HIV treatment engagement and has become a cornerstone of improving health among people with both HIV and opioid use disorder. Over the past few years, some harm reduction agencies have also begun to offer buprenorphine treatment. Although this treatment expands access to this important medication, the protective effects of buprenorphine may be very different in these settings than in traditional clinical settings. With this grant, I will carry out a qualitative study of people with HIV and opioid use disorder who have received buprenorphine treatment at local harm reduction agencies. Using semi-structured qualitative interviews, I plan to 1. Elicit perceptions of barriers and facilitators to antiretroviral treatment for HIV, and 2. Examine how buprenorphine treatment influences antiretroviral treatment access and adherence. To differentiate the qualitative analysis, I will collect data on antiretroviral receipt and adherence, as well as HIV viral suppression status. I hope that the findings of my research will honor the legacy of Dr. Linn by improving HIV treatment among people who are often underserved and at high risk for worse health outcomes. Thank you very much.